Welcome to Nourish MD, Dr. Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone. Welcome back to Nourish MD. I'm one of your hosts, Romana Brennan.
And I'm your other host, Lauren Papanos.
And today we are following up on our previous episode all about gut health. So today we will be discussing what the repair phase and rebalancing phase looks like. But last week we talked about testing, opening, and removing this framework that really takes us through how we address gut health and work toward healing. So Lauren, why don't you kick us off where we left off last time with really discussing that re-inoculate phase after we've already opened and removed. Now we move on to the re-inoculation.
Yeah, I think this is a great place to pick back up. And we alluded to a little bit about this last episode. So definitely make sure that you listen to that past episode because it really feeds into this third step, we'll call it. But I think this is a step, if you will, that many people do for too long. A lot of times what we see in practice, right, is that people are constantly re-inoculating their gut by staying on probiotics chronically. And while there are certain health conditions that may be advantageous for, the broad majority of people, long-term probiotic supplementation may not actually do much in terms of its effect on the gut. We know that more focusing on dietary intake of prebiotics, which are the food that fuels these bacteria that are already present in our gut, is going to be more beneficial. And there's a couple of reasons for this. One of the reasons is that unless you are getting a spore-based probiotic like Bacillus coagulans, which there is one or two brands that we recommend for some patients that are spore-based, but the average probiotic that you're going to get at the store typically going to be just dormant strands of bacteria, and they are also generally shelf stable, or they recommend that they're shelf stable. But really, the only truly shelf stable probiotics are these spore-based probiotics. And one of the issues that comes in with a lot of these is that you lose a lot of potency as these probiotics make their way into the GI tract. And so you obviously take the probiotic supplement, right? Then it has to go through the GI tract. Then it has to actually inoculate and colonize the gut. But a lot of times what happens with these traditional probiotics is that they don't actually retain any potency when they're sitting in the bottle. So on the bottle, it says how many billion CFUs are in the probiotic when it's bottled. But by the time that you actually start taking that supplement, that level does decrease dramatically. And it could even not have very much in it from, at the point that you start taking it. And then once you actually take the supplement orally, there's a high probability that it's not going to colonize. The other thing to know about this is that they really only stay in your system for about 4 to 5 days. And so once you come off of normal probiotics, if you haven't taken them in 4 or 5 days, they're not going to make a big impact on your microbiome, the beneficial bacteria. However, these spore-based probiotics like the Bacillus coagulans, we've seen a lot more in the research, more survivability, not only on the shelf, so while the probiotic's sitting there waiting for you to take it, but also through the GI tract and into the colon once you've actually ingested the probiotic. And it seems to have a bit more of a long-term effect in terms of how it supports the microbiome beyond just those 4 to 5 days after you've taken the probiotic supplement. So these are just some things that we should know about just general probiotic supplementation. And Romana, you and I both, we use probiotics for certain conditions, right? We talked about last month about UTIs and bladder health and how Lactobacillus rhamnosus, for example, is a really great probiotic for that. There's other types of probiotics that can be used for certain skin conditions and blood sugar control and things of that sort. But I'd love to just hear a little bit more from you about kind of what your take is on these different types of probiotics and really where someone should maybe be using them if they're looking to purchase a probiotic supplement.
Yeah, 100%. And I first want to acknowledge too, I have patients all the time say, oh yeah, like I've been very regular since I started taking this probiotic. So I'm taking it long-term because it helps me with my bowel regularity. And of course I want to recognize that and address that. But also we want to think about, okay, if you can't go to the bathroom without taking a probiotic, that's something that we need to address. Maybe in the short term, fantastic that you found a short-term solution to help you stay regular, but are we having enough prebiotic fiber in the diet? Are we eating enough legumes if we can tolerate legumes, which is a great source of that prebiotic fiber? Just little things like this that we can troubleshoot or support the gut in other ways, support bowel regularity in other ways, as opposed to just taking a probiotic and saying that everything's great. Because what if there's something else involved that we really do need to address? It's similar to, of course, medications play a very important role, but if we're not getting to the root cause of why we might be needing a certain medication, why we're having particular symptoms, then we really need to address the root cause. We want to figure out, okay, why are you having chronic diarrhea? Why are you chronically constipated? And really address that fact, as opposed to taking a probiotic and saying, oh, great, this solved all my problems. Like, well, we do still want to figure out why that's happening in the first place.
Yeah, definitely. No, and I think that's a good point, because a lot of people do feel better when they take them. And maybe in those individuals too, they have too little of the probiotics. And so they actually need more to be able to help them digest and degrade that food. But then there's other populations of people, right, where they might have too much probiotics. And unless you test, you don't know. And in those individuals, maybe they don't see as much benefit from supplementation. But we were talking about the different uses of probiotics, both traditional probiotics and then also spore-based probiotics. And I mentioned how Lactobacillus rhamnosus is like one example of one that's used a lot in UTI and in just overall bladder urinary health. And I was just curious if there were any other uses of probiotics or any other recommendations that you have on probiotic supplementation for someone who maybe wants to be on a probiotic more long-term.
I really like Saccharomyces boulardii. Saccharomyces boulardii is actually a yeast-based probiotic. And like you had mentioned, the use of probiotics, I know you and I both agree in terms of this. We like using it therapeutically as opposed to long-term, but maybe for a couple of months while we're addressing some other type of situation. But Saccharomyces boulardii can be especially useful if we're having any kind of underlying GI symptoms that we need to address as well. For example, H. pylori, which can be an overgrowth of a bacteria that can impact our stomach acid secretion, the rate that we're digesting, which again, this is something that we can test for, but really utilizing it therapeutically for things like that. It can be helpful for on antibiotics because it is yeast-based. It is a little bit more robust, I would say, and helping buffer the use of antibiotics and helping blunt the negative effect that antibiotics can have on the system.
Yeah, that's a good point, is after antibiotics or even during antibiotics, it can be really helpful to take a probiotic to re-inoculate the gut. And there was actually some research that came out a few years ago that, and I don't know that there's quite a 100% consensus on this, but that you want to actually wait a couple of days before you start on so Saccharomyces boulardii, like Romana mentioned, is a little bit different because it's yeast-based. So I think that's a great option to do alongside antibiotics. But there was some research that showed that you want to wait about 4 to 5, maybe 7 days after coming off antibiotics before you start on more of a broad spectrum probiotic, because you want the gut to be able to re-inoculate itself first and kind of see how far you can get, essentially let the body come back into balance on its own. Because when you start adding in this probiotic supplementation, you're essentially influencing what the body should be doing. You're kind of influencing how it's going to re-inoculate, right? So it might be more beneficial to allow the body to do that on its own for a few days. And then after a week or so, then you reintroduce a more broad spectrum probiotic to help really kind of rebuild the gut of what's been destroyed.
Absolutely. Yeah. And we have some great recommendations too. If you want to work one-on-one with us, if you have been on antibiotics, there's some great options through FullScript that we have access to. Another one that you had sort of alluded to, but I don't know if we've actually mentioned it, is Akkermansia muciniphila. So that probiotic can be really beneficial for blood sugar balance. So if we know that that's low from testing, or if we have determined that that's low, that can be really beneficial to supplement with. We also know that the primary food sources are the fibers found in things like berries. So if we haven't already incorporated berries into the diet, not only are they wonderful sources of antioxidants, but they're also this primary food source for the Akkermansia bacteria, which again can be helpful for blood sugar balance.
Yeah, wonderful. That's a good point for sure. Let's talk a little bit about beyond probiotics. So once we've started to support this probiotic or this like bacterial recolonization that we're after, this next step is that next R, which is repair. And when we talk about repair, there's a few different things that we're referring to that we want to repair within the gut. Can you just tell us a little bit about why do we need to repair? Like, isn't probiotics enough to be able to rebuild? What does repair mean, and how does that differentiate from, using probiotics to rebuild?
Yeah. So our gut lining, now this is where we kind of open the door to discuss intestinal permeability, which is quite the buzzword. But intestinal permeability, also known as leaky gut, why does this happen? When does this happen? So our gut lining, the endothelium of our intestines, is essentially about 1 cell thick. So it's not very thick, but it's really important to regulate what types of materials we're absorbing, macronutrients, micronutrients. So our digestive system, essentially this tract that goes from our mouth all the way down, this is essentially outside of our body in a way. And so the endothelial lining is really important for regulating what comes in. And we have what are called tight junctions in between these cells, kind of like we're holding hands. I know if you're listening to this, you can't see me, but it's kind of like we're holding our hands if our fingers are interlaced. And what intestinal permeability refers to is spacing in between those tight junctions and kind of loosening. So if it's not necessarily like a tight hand grip, but maybe it's depending on how large the spaces become, inflammation can influence this. What else can influence this, Lauren?
Your diet. We know glyphosate, which is a common herbicide, gluten exposure, are other potential aspects, stress as well.
Yeah. So there's a lot of different factors that can influence essentially the tightness of these tight junctions. And when those spaces are increased, that provides the opportunity for any toxins that are in our diet, on our food, bacteria that may be opportunistic. So ones that we don't necessarily want in large quantities that can bypass our epithelium and enter our bloodstream, which can cause additional inflammation. So that's a little bit of the how and the why the gut lining can be compromised, which really needs to be addressed if we're going to move forward in rebalancing and effectively repair the gut, because otherwise, we can take all the probiotics we want, but if we're not actually patching the hole, then there's still going to be issues there. So Lauren, why don't you tell us about some of the key nutrients? How do we even go about starting this process? And maybe we can even backtrack to how do we know if this is a problem for us?
Yeah. Well, I'll say across the board that it's likely a problem that most people have some degree of intestinal permeability. It's very rare that we see someone who doesn't. So I would say, generally speaking, this is something we all need to be supporting. This step really needs to happen simultaneously. So it shouldn't be in isolation. It should be alongside these other steps, because part of what creates the permeability is the imbalance of the bacteria in the gut. So we talked about your microbiome, and your microbiome is really this umbrella term that it houses good, bad bacteria. And when there's an overgrowth of bad bacteria that maybe shouldn't be there, then that in itself is going to drive a permeable environment. So it's one of the reasons why we have to go through the remove phase and we have to go through the rebuild phase, because those are going to also help support the repair process. But there are certain nutrients that are going to strengthen this gut lining and to be able to support this rebuilding. There's certain nutrients in our diet through foods we eat. These are things like zinc-rich foods. Zinc is a mineral that is found in a lot of your shellfish, nuts, and seeds. Vitamin A is another really important nutrient, and vitamin A, we don't get in a lot of foods, unfortunately. We do get beta carotene, which is what's in orange vegetables like bell peppers and sweet potatoes, but that has to be converted over to vitamin A, and a large chunk of the population doesn't have a great ability to convert that because of genetics. But we can get vitamin A through grass-fed red meats, especially beef liver, whole dairy. When you eat fat-free dairy, the vitamin A isn't there, but when you eat full-fat dairy, you do get some of that vitamin A in its most active absorbable form. So So that conversion from beta carotene to vitamin A doesn't have to happen. You're actually ingesting the vitamin A as is. Then anything that's going to help to support reducing inflammation is going to be really important. So we like to use things like demulcents, which are things like slippery elm and aloe vera, marshmallow roots. These can be really powerful plants that can help with this process to be able to heal and seal the gut lining. And we typically will do that alongside of a particular amino acid that's called glutamine. And amino acids, think of them as the building blocks of how our body makes protein. Now, essentially, if you take protein and you break it down into a smaller element, that would be amino acids. So glutamine is what you find in a lot of your protein sources because of that, primarily in things like your bone broth. Collagen has some. Meats that has bone in it is also a great way to get glutamine. So we want to have an abundance of these nutrients, either coming in through food and or coming in through supplementation, so that we've got a therapeutic amount to be able to really reduce that inflammation in the gut and start healing and sealing the gut lining in those tight junctions, like you mentioned.
Enjoy high-quality supplements shipped right to your door with full script through Private Physicians Medical Associates, PPMA. Reap the health benefits of pharmaceutical-grade vitamins while saving 5% on all orders. Set up your free PPMA account today. Visit privatemds.com.
Yeah, and we can kind of think about it as wound healing. What are the important nutrients? We need those proteins. We need that glutamine. And similar to what we're talking about with intestinal permeability, the focus is tissue repair. And what is tissue repair? Tissue repair is wound healing. So it's all kind of one and the same. And we can think about it in a similar light, really needing those antioxidants, the zinc, the anti-inflammatories, things of that sort.
Absolutely. Yeah, they're all really important pieces. And this repair doesn't happen overnight, right? Any repair process in the body, like you said, like wound healing, it takes time and it goes through phases. So this could take a couple of weeks. It could take a couple of months. It could take several months, depending on your individual needs. But once we've done this rebuild and repair, like we've talked about, then that's really where we focus on rebalancing of the gut. And there's a little bit of crossover here, but I'd love for you to just tell us a little bit more, Romana, about what goes into this rebalance phase. What are the aspects that we really highlight here?
So we have our nutrition factor. How are we rebalancing in terms of getting enough fiber to feed those good bacteria? So prebiotic fibers found in really any plant foods, but artichoke, asparagus, berries, things of that sort are fantastic sources of prebiotic fibers. Beans are a great source of fiber, as I had mentioned earlier. We really want to make sure that we're getting enough fiber. The USDA recommends women have 25 grams of fiber and even more than that. But I would say if we can surpass that, then that would be ideal. If you can identify, okay, I probably have a low fiber diet, we want to increase that slowly because we certainly don't want to cause any digestive upset, any cramping, things like that. So if we're working to increase our fiber intake, we want to do so slowly. Protein is also a key nutrient for the liver, as it's important for creating enzymes that are key for detoxification. So in order for proper liver function, which we discussed in the previous episode, liver function is essential for this opening and removing phase to make sure that we're digesting and using the restroom every day. Having protein to provide the amino acids that serve as those building blocks for enzymes, different proteins in the body, even for our immune function, protein is really the core for this. So it's really important that we're prioritizing protein, fiber from a variety of different plant foods. We get different types of fibers in different types of plants. So really having enough variety there is going to be key. Aside from the nutrition piece, we can also think about lifestyle habits and routines that support our gut health. So as we're rebalancing, as we're focusing on how we get our gut back into good shape, we want to also think about how we're eating. What is the environment around which we're eating? Are we showing up to our meal feeling frenzied, feeling stressed because of the workday, and then we're eating our meal and then going back to this crazy workday? Because our body's not going to be recognizing that it's in preparation for our meals. So we want to make sure that we're in what's called the parasympathetic state when we're showing up to our meals, not the sympathetic state. You may have heard the sympathetic state as this fight or flight state, and then our parasympathetic is what we call our rest and digest state. When we're in those meals, we want to make sure that our body is registering it is time for resting and digesting. During that nervous system state, that's when we're secreting our digestive enzymes, stomach acid, things that are going to be supportive for the digestive process to effectively happen in our body. So it's really important if we are having a crazy work day, we're not eating in front of our computer, just shoveling food in our mouth, but we are taking a second, maybe stepping away from our laptop, our phone, whatnot, and taking a few breaths. Maybe we implement a gratitude practice before our meals to slow down and separate the craziness from our lives from this eating period. So that's going to be super important and help with mindful eating so we can be in touch with our bodies during those times and really assessing our hunger cues and also our enjoyment of our food. If we can enjoy our food, that is going to digest so much better. There's been plenty of studies that really highlight this mind-brain connection, and it's not just about how we're digesting, but it's also about how our mind is impacting that process.
Yeah, there was even, I know, a study that showed that the way we think that the food's going to impact us actually does, right? So if we go into the meal and we think that meal we're eating is going to make us gain 5 pounds, that it is going to influence your weight, right? Or you think that it's going to impact your gut and cause you bloating, that it is going to create that, right? So as you mentioned, our mind is a very powerful weapon as it relates to our gut, and everything we eat goes through our gut, right? And our brain and our gut are super interconnected. They're constantly talking to each other through our vagus nerve. So we hope that all this information we provided gives you some context around the different pillars and elements that go into gut healing and the work that we can support you with at PPMA. And so thank you so much for listening to both of these episodes. If there's any take-home message for you from these last 2 episodes, first and foremost is to know that you don't have to live with the gut symptoms you have forever, that there is hope. And a lot of that can be done through what you eat and the how you eat, and through healing of your gut environment being things that we talked about, right? The probiotics in your gut, that microbiome, that gut lining, all of these factors go into your ability to feel well digestively. And so if you have any questions or you'd like to get one-on-one support, you can give the office a call and they'd be happy to schedule an appointment for you. And we'll be back next month. Romana, do you remember what we're talking about next month?
Yes, we have inflammation and chronic pain on the docket for you all. So it's going to be a really amazing topic. We have Dr. Boz from UCI with us. So we're really excited to share that conversation with you all.
Yeah, that will be a really great conversation. And then we'll come in a couple of weeks later with the nutrition piece of inflammation. So again, we will be back in a couple of weeks. And thank you guys so much. Have a great rest of your day.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.